It's time to double down with Max and Stacy on Sputnik Radio. Coming up on the show, we talk to Dr. Bob Gill about all the latest in the United Kingdom's not-so-national health system. But first, with PFIs, so-called private finance initiatives, gobbling up more and more of the budget of individual hospitals and trusts, and as the NHS has lost over 50% of its bed capacity in the past 25 years, the fabled national health system in the UK is starting to look in dire health. In fact, some say it's on life support, much like Obamacare. Stacy.
Yes, Max, here in the United Kingdom, we have so many headlines about the healthcare system here, and it does look a lot like the Obamacare headlines. With Obamacare, you have all these private health insurers, they're bailing on the system. Here we have a national health service, but the national part of it, i.e. the government, the taxpayers, bailing on its system as well. And we have a fresh wave of strikes coming from the junior doctors, but first, the NHS faces a fresh wave of drastic cuts, new documents reveal. The BBC has announced a draft proposal to make drastic cuts to the NHS England services have been uncovered as part of the government's continued austerity plan. The Sustainability and Transformation Plans, STPs, not STDs, STPs, have been drawn up in order to help find the £22 billion of quote-unquote efficiency savings, i.e. cuts, which are still needed to meet former Chancellor George Osborne's targets for 2020-21.
Right. Well, the ongoing NHS saga. The great thing about Britain, once upon a time, was that it had this great healthcare system. It had university education available for free, essentially. And you had this remarkable culture that was the result of welfare, social programs, and that's all being destroyed. And the result is a lot less social cohesion. But here's my theory about this whole NHS being privatized and destroyed and why most people don't really care much about it or unaware of it is because they still maintain this free at the point of service. So as long as people can still walk into an NHS and get a Band-Aid or, they can have someone look down their throat or look into their eyeball for free, they assume that all must be well. They don't understand that behind the scenes, it's all crumbling. The facade, that free at the point of service, it still remains. But behind that facade, things are crumbling. Someday, it's coming soon. British people will walk into the NHS and they'll say, I don't feel good. And the person will say, great, give us 20 pounds. And they'll be like, what? What's going on here? But by then, it'll be way, way, way too late to do anything about it.
Well, on top of that, you also have, when Teresa May became the new Prime Minister of the United Kingdom over the summer, she kept Jeremy Hunt in position of the Minister of Health. So the NHS, all the doctors, everybody seems to hate him. Everybody expected him to be ousted when she cleared out her cabinet and installed her own loyalists. Well, he remained. But junior doctors are now to stage quote-unquote worst strike in NHS history. That comes from Jeremy Hunt himself, calling it the worst strike. But they're due to take a strike between 8 a.m. and 5 p.m. between the 12th of September and 16th of September as well. So to find out more about this, we're going to go to Dr. Bob Gill, as you said. He's coming out with a film called The Great Nhs Heist. He's a doctor, a GP, an activist, and a filmmaker. Bob Gill, tell us, why did Teresa May keep on Jeremy Hunt?
Well, Jeremy Hunt has served a very useful function. He's the fall guy. He's the puppet in front of policies that were determined actually a couple of decades ago. The person we should all be focusing on, of course, is Mr. Simon Stevens, formerly President and Vice President of United Health, who also served in the Blair governments, and before that he was a policy advisor and a policy analyst. He worked in the United States, in New York. He got to know how their system works, and then came over here, joined the new Labour government. He's the person we should be focusing our attention on.
He's the head of NHS England.
Yeah.
He was at United Health, which is one of the largest private health insurers in the world. Mm-hmm. Huge. I think it's number one in the U.S. Mm-hmm. And so, when you hear about those stories of the U.S. healthcare system, it's actually insurance companies, which really have nothing to do with health, or health provision. Those are the guys that are making $30-40 million a year. This sort of model, and that's being brought here to the United Kingdom. Is this why the junior doctors are going on strike?
Well, we're in the phase of actually forcing the staff out of the NHS. So you're going to have a system which is crumbling, as Max said, struggling to cope, and staff morale will nosedive. They will use the exodus of doctors created by this contract to justify more closure. So each time they close a publicly owned hospital, then you will have the asset grab, the land will go, and you'll get more and more contraction of services, harder to access. So the people who are the most deprived and the poor with the highest health needs have to travel further to access care.
Contrast it to the Brexit debate. Because Brexit was positioned to the lower classes in Britain as a way to kick the upper classes in the teeth, it won. Because people around Britain said, oh my God, you mean I can get David Cameron, that posh boy, fired? All I have to do is vote for Brexit? Regardless of the fact that economically it's the worst thing that could possibly ever happen to anyone who doesn't work in the City of London. That was never considered. With the NHS debate, the representatives of this typically are doctors or junior doctors, and they sound posh because they are posh. They've had a lot of training. They went to school. But the average British person listens to them on television and they go, I don't like posh people. I don't like those people. I don't have it. They don't equate the fact that they're getting great service at a great price with this, what's happening to these junior doctors. How, my question is how, can you make the average punter in the street in Britain who just wants to beat up on posh people understand that this is a way to beat up on posh people if they stop this privatization?
With the NHS, the doctors' and patients' interests are completely aligned. There's no third party trying to siphon away money. There aren't any conflicts of interest built into the system. Now that is being changed, but the perception amongst the public has a large part to do with how mainstream media paints the dispute. And the BMA have been atrocious.
The BMA is the British Medical Association?
The British Medical Association, our union, the messaging has been self-defeating. In fact, they recommended that the contract was accepted. They are not pointing out to the public that the attack on the junior doctors is part of a bigger problem.
Dog days of summer in August, there have been a lot of leaks and memos being released and documents being revealed about the state of crisis in the NHS. And one of those was to do with the over 20 billion pounds of cuts that are having to be made. We're going to go to that in a second. But first, I wanted to talk about there's some sort of report that was about the 7-day NHS, that the Tory government received a mandate to bring about this so-called 7-day NHS. And yet this report, written by their own bureaucrats, their own mandarins, told them basically that they only have a 5-day budget, so that they have to increase the budget if they want a 7-day NHS, and yet we're talking about 20 billion pounds in cuts coming. So what is that actual document that was addressed to Jeremy Hunt, and what was it about the 7-day budget?
There's a big black hole, you cannot finance these. But the whole 7-day narrative is completely false anyway. It was put forward as, the argument was made that there was an increased death rate on the weekend, which has been blown out of the water. That's non-existent. The government have to create a false narrative to pull the wool over the population's eyes, to present this as an improvement. But it's designed to mislead. The reason they want people to have routine care on the weekends is so that the assets can be sweated. When the corporates take over the hospitals, they don't want theatres lying idle over the weekends. They want them to be used, and that's what this is all about. So it's got nothing to do with improving patient safety. It's a complete false narrative, like weapons of mass destruction in Iraq. We're still waiting to find them. You need a plausible narrative to pull the wool over people's eyes.
Well, even in America, there's no 7-day healthcare system. You can't get chemo on a Sunday.
Well, that's right. No developed system in the world has routine work delivered on the weekends. It just doesn't happen. So what they're setting up is the failure, setting up the justification for more closures, setting up a system which will push out the qualified. Then you will allow in the de-skilling agenda, replacing doctors with nurses, replacing nurses with healthcare assistants, replacing healthcare assistants with volunteers.
Well, let me take, if I can, like the other side, another side of this argument. I've noticed, living in this country, that British people are remarkably remiss when it comes to their own health. There's too much drinking, there's too much eating, they're obese, they're alcoholic in many instances in these towns all over the north. Because they have the ability to walk into the NHS, on a Saturday night and get treated. If in fact they had to pay for their own health and take care of themselves in a responsible way, it might be a great boon to the health of this country, because right now they just have outsourced their health to the free NHS, and they just abuse their bodies horribly. And you see it in these towns up north every Thursday, Friday, Saturday night.
There's certainly a large impact on lifestyle, on healthcare needs. But if you look in the US, where they have the insurance system, well, they don't have healthier lifestyles as a result of fearing medical bills. People are, again, you've got the food industry advertising, promoting junk food left, right and centre. You've got the sugar industry promoting their products left, right and centre. For every pound spent on public health information, there's about 600 spent on advertising of junk food and all the rest. You cannot compete with this. But no doubt people can do more for their health, but that's another dangerous myth to fall into, that healthcare is your own fault. It's the individual's fault. And that's what the NHS chose not to do. We will take a collective decision to look after each other, and that has massive effects in terms of efficiency of the system, but this has all been thrown away.
Now, your film that you're working on is called The Great Nhs Heist.
Mm-hmm.
Now, that goes with this 22 billion pounds of quote-unquote efficiency savings that need to be made. And as I said in the quote from the article, the BBC has announced a draft proposal to make drastic cuts to NHS England. Now, that's part of the heist, right? Because people think NHS means their National Health Service, but NHS England is actually a private body, right?
It's not a private body, it's a government quango. It's an arm's length institution. In fact, the way it's set up, the Secretary of State is no longer responsible for healthcare. He issues a single instruction per year to Simon Stevens, and Simon Stevens runs the show. He holds the budget. The heist is the setup for financial collapse. So we're being softened up to say the only way to save the NHS is, guess what, top up insurance or out-of-pocket charges. The infrastructure is already being laid there, and using the immigration narrative. So look at all these immigrants coming over here, using our services. Why don't we put in a charging structure?
Students here exit university with more debt than American students, and we've had private, high tuition costs for decades, and you've already passed this. So could you see this heist resulting in you also having a healthcare system that gets more expensive than even Americans pay?
What will happen is you'll have a skid row NHS providing basic services, emergency services, and in order to replace what you've lost, you'll have to take out top-up insurance. The cost to the individual through taxation and insurance will likely be double what they're paying now. So the NHS, before it was marketized, before you had the millstone of private finance initiative, was the most effective way of delivering healthcare. That has been squandered. We've had billions invested into setting up this heist, and that's what we want to expose in our film. It's a very complex, long-term financialization, destabilization, and now we're into the negative propaganda phase. Attack the doctors, attack the nurses, blame the patients. Meanwhile, you pick everybody's pocket.
The patient and the doctor are on the same side. And that's the beauty of the NHS. And the cost efficiencies cannot be measured purely in pounds and cents. There are holistic efficiencies that come over time, and a quality of life that comes with that kind of relationship. So when you gut that, and you now have predators in the mix, and the patients are no longer on the side of the doctors are no longer on the side of the patients, your health system is going to deteriorate.
This was shown in a Nobel Prize winning piece of economic work in the 60s by Kenneth Arrow. He said this system doesn't work. It sets up conflicts of interest. You have market failure, as you see in the States, Medicare, Medicaid, and that's where you end up.
All right. Well, that's it for this episode of Double Down with me, Max Keiser, and Stacy Herbert on Sputnik Radio. Thanks to our guest, Dr. Bob Gill. Until next time. Bye, y'all.